Hey man,
How's it going?
good. How about you?
It's going well. It's going well. Just getting started on the day.
Okay. Thank you for answering the invitation, man. Thank you.
Absolutely. I'm excited to be on here and talk with you.
So how's everything over there?
It's good. It's starting to get cold. No snow yet. But business staying busy. Everyone's trying to get healthy before the New Year's resolutions kick in, and make sure that their body's feeling good so that they can work out and get in the gym.
Okay. How about the COVID?
COVID it's definitely picking up. I'm realizing that there's a lot of people that are testing positive that are either having minimal symptoms or no symptoms, and so it's spreading a lot, but it does not seem to be as severe, which is a really good sign.
Okay.
Yeah.
So first of all, can you introduce yourself for the coaches in Taiwan?
Yeah, absolutely. So my name is Dr. Michael Risher. I'm a sports performance chiropractor based out of Chicago, and I do a lot of work with athletes, but really I work with anyone that has pain or wants to improve their body.
Okay, cool. So I followed your Instagram, and there's Jamal Adams and some of the NBA players, and I've noticed that you talk a lot about fascia training, right?
Mm-hmm.
So usually when SNC coaches or performance coaches train athletes, we just talk about how do I say this? Heavy lifting or movement, that kind of
Mm-hmm.
stuff. I
Yeah.
know there's functional pattern, but what exactly is fascia training?
Yeah.
Or how
So
to train sorry.
no, go ahead.
Or how to train fascia.
Yeah. So that's a great question, and it's something that I've kind of been focusing on for the past couple of years. A little bit more in depth because when you learn in school, you really learn a musculoskeletal based approach, and you learn when you're a strength and conditioning trainer, you learn a muscle based approach, and that's not bad, right? There's benefit to that. There's benefit to understanding those biomechanics and how the muscles work together. But what I've kind of done is looked at fascial patterns and decided to train movement patterns based off of fascial principles. And so let's backtrack a little bit and talk about what fascia is, because that's kind of, I don't know, not when I talk to normal people that come in, they're not really sure what fascia even is. And then as you talk to the trainers, there's a little bit more of an understanding, but not always as in depth. And so fascia is a connective tissue. And so what I tell everybody is if you it surrounds everything in your body. If you took away all your bones, muscles, organs, skins, everything, and just left the fascia, you would have a perfect outline of your entire body and everything in it. Fascia is continuous. So, where my bicep starts here, ends here, fascia is continuous along the entire chain. It's continuous throughout your entire body. So that's what fascia is. It's a connective tissue. It has contractile properties, which means it does have contraction to it. It has elastic properties. It's largely collagen based, and the big thing that kind of, I don't know, helps people understand is if you have pain, right, you have to kind of determine what structure that's coming from. Muscles don't feel pain nearly as often as you think they do. The bones, you don't injure your bones nearly as often as you think they do, and so you can really see a lot of pain in people because of their fascia. And so when you're able to not just look at, okay, what joints are affected, what muscles are affected, and you can look at fascia as an entire system, not only can you move better, but now you can treat pain better as well. So that's a little bit of a kind of an overview. Are there any specific questions that you have based off of that?
No, not really, but like from what you just said is like fascia is different than muscle. It's like the whole body connect to each other, right?
Yes.
Still, but how to train this?
Right. So there are a bunch of different ways to train it. I like to start with isometric holds. That way you can gain an understanding of like what that tension feels like. So just for example, right, you have a lot of highly integrated fascia on the bottom of your foot. Everyone's heard of plantar fasciitis for the most part.
Yeah.
And plantar fasciitis is inflammation of, sorry, my dog's scratching something over there. Plantar fasciitis is inflammation of the fascia on the bottom part of your foot. And so that is really, really integrated. And so we can create a lot of tension in the bottom of your foot. And then if we kind of stretch the entire rest of that system, you can feel tension not just in your foot, but also in your calf, also in your hamstring, also in your glute. And so that's kind of how I like to start with an isometric, a hold, where you start to just become aware of what that fascial tension feels like. And that's really the best way I've found to start the training, is to start training with tension. And I may jump all over the place here, but your
Okay,
body,
it's okay.
your body adapts to the stresses put on it. And so if we can put tension on the fascia in the direction we want to strengthen it, that's where we start to train the fascia. Yes, you train the muscles. Yes, you train movement patterns and all that. And I think all of that's very much connected. But essentially, if I put tension on the bottom of my foot and then I put tension in my glute and I stretch in that direction that I want to, or slowly eccentrically contract or isometrically contract, and just hold that tension in the direction that I want those collagen fibers to be aligned, that's the start of fascial training. Excuse me. Then we can get into, okay, well, how do you use that? What elastic recoil properties are there? How do you go into plyometrics? How do you go into rebounds? And you can start to break it down. But I think at the very base, if you think, can I create tension along that fascial chain that I want to have tension on? And then can I maintain it? And can I organize my collagen fibers in that direction? Henry, off. Sorry, dogs chewing.
No problem,
Dogs chewing
man.
on stuff. Can I organize the collagen fibers in that direction? That's where you start to look at training fascia. And give me one sec here. I got this.
Okay, no problem.
This is a little guy. He's only 4 months old, so he's still learning.
Cute.
Thanks. So yeah, that's how we start to train fascia, is really isometric, gaining that feel of what the tension is, and then from there, how do you learn to use it? How do you learn to store energy in the fascial tension and then utilize that on the field?
Oh, so that's the post. That's when you post. That's like the one you post on Instagram, which the movement is like sprinting drill, like wall
Yes.
drill. Yeah.
Exactly. So what we're doing there is, if I'm working on if I'm a linear athlete, if I'm a track and field athlete, I really just need to focus on moving forward. If I'm a baseball player, football player, you need to add a lot more rotation in. But I work with a lot of NFL or guys training to be in the NFL, so they need to work on their 40-yard dash start. So that has me thinking, okay, if we want to make them stronger in that direction, how do we do that from a fascial perspective? They're going to have their sprint coaches. They're going to have their strength and conditioning coaches. And so their muscles are going to be good and their form is going to be good. I don't need to mess with that. How can I help create more tension on the foot? And how can I use that in the direction that they're going to be sprinting? So I was using my arms to push myself into that loaded 40-yard dash start, kind of get to the end of that slowly, and then drive out.
Cool. So does that mean like when you start training fascia, you're gonna do like elevated stuff, like elevated iso lunge, that kind of stuff?
Yeah, so I first like to start with the full foot on the ground.
Okay.
I find that oftentimes there are limiting factors and muscle weaknesses that you can't actually move to heel elevated and still have that tension that you want. So Henry, hey. Oh my God. All right, he's good. Sorry.
No worries, no
getting into
worries.
stuff
It's
today.
good, it's good.
So I find that if you start with the foot on the ground and start to actually train the muscles that allow your body to be put into that tension, specifically tib anterior. A lot of people can contract tib anterior if their foot is open chain or their foot is off the ground, but it's really difficult for them to find that closed chain tib anterior where it's kind of pulling up on the arch. And that's a really important part of this training. So if we go straight to, if we start with the heel on the ground, you have a lot more surface area to distribute force, and your tib anterior is asked to do way less. As soon as you elevate your heel off the ground, now your tib anterior has to do way more and support way more weight and create way more force. And so if you haven't learned how to do that yet with your heel on the ground, if you haven't kind of developed that requisite strength in your tib anterior, all of a sudden you fall back into that old pattern and you're doing the heel elevated stuff, but you're not necessarily getting the fullness of the exercise, if that makes sense.
Okay. So does that mean like that's where the barefoot training comes, right?
Exactly. And that's why I love to start with just barefoot training, because by barefoot training, you are strengthening your feet and you're going to gain way more ability for your foot to do all of the fascial training. If I have you go out and you change nothing about your life, but for a week you train barefoot, if you come into my office at that point, now I know you're going to be so much more able to do all of the exercises that I want you to do.
Cool. So getting back to the fascia training, so instead of like linear stuff, or like, can you like tell us about like there's like specific movement for like lateral movement for training for fascia training? Or let's say I'm a trainer and I wanna like design a movement or design a movement for training fascia. How can I like just pick up any movement and know how to like what specifically am I training?
Right. So the first thing that I think you can understand is anytime you're doing like an eccentric movement, you will train the fascia regardless. So if you want to just at a base level, if you want to start training fascia, add in more eccentrics. If you want to do a lateral movement, maybe a lateral partner resisted like lateral lunge that's an eccentric, that could be just a start, right? And so if you want to, I mean, you can get as deep in the weeds as you want on all this stuff, upper body, lower body, core, but just kind of at that base level, if you can body weight, find the movement pattern you want and train it eccentrically. Now I do find that having an anchor point to the ground is very helpful. So whether you're training upper body or lower body, like training an eccentric bench press is not going to be as optimal for that fascial training. It's a little bit more segmented. So I like to have an anchor point to the ground if I'm going to do it. So I prefer a lot of bear crawl type stuff for the upper body, crawling patterns, rolling patterns, that sort of thing. So that's kind of how I would start. The way that I like to look at it and kind of come up with these exercises is, okay, what is the movement that I want to train? What is the movement that is lacking? Is it a 40-yard start? Is it a lateral jump? Is it a throwing motion? Right? I have several throwing athletes, and so is it a throwing motion? Now, where is the place that movement is generated? For the most part, it's coming from the foot. right? And so you start with what is the tension that I need to put on the foot, and then how do I rotate myself? How do I side load myself? How do I get myself into that position that I want to train? And then, go with the eccentrics. There are a couple other ones where you kind of take it to end range and you do 1 second contraction, 1 second relax, 1 second contract, 1 second relax. So there are kind of a bunch of different ones, but really at a base level, it's find the movement pattern that you want, find the anchor point with the ground, and then load yourself eccentrically into that position.
Okay. Can I understand it this way? It's like training kinetic tissue, right?
Yes.
So let's say if I want to train jumping, and the movement pattern was like a little bit like deadlift, a little bit like squat, so I do a little bit of both, but with more focusing on eccentric training.
Yeah, and so I would even think very, very seldom is it a straight up and down jump that you're training. Oftentimes it's a forward, it's a side. So I actually like to load kind of back into a direction. So instead of, and I'll stand up here, instead of just doing a normal squat, I'll actually have something load me back and down. Does that make sense? Or
sure.
if I'm doing a lateral jump, instead of just going straight down, I'll load side and down, and then you can train in that direction. Because I mean, not even really volleyball. Even volleyball, you get a step up, you're still moving in a direction, right? And so it's very rarely just straight up and down, which you can do that sort of training. But I really like to break it down even further and say, all right, can I load in a direction?
Okay, so then where do you think like fascia training fits in the whole year training plan?
I think it's something that's best when done regularly. So it's not something that you have to say, okay, we're in a hypertrophy phase, we can't do fascia training, or we're in a strength phase, we can't do fascia training. I actually I'm a West Side barbell conjugate style trainer myself when I was doing it. So really the whole year is its own cycle, and you're kind of adding in what you need. I've been talking to some other docs and practitioners, and it seems that accumulating about 20 minutes a week of fascia training is effective, right? And that's kind of like maybe the minimum effective dose where you're going to see a change is making sure that throughout your entire year of training, your entire training cycle, getting 20 minutes a week is kind of minimum. You can go up. There's no real upper limit, which is the nice part, but you don't need a crazy amount to see an effect. So if I'm a trainer, I'm thinking, okay, what sort of warm up, what sort of intentional warm up can I actually make fascial training? And so when I give my patients homework, if they're going to run or if they're going to the gym, everything that I give them is structured as a warm-up so they feel primed, but also it's centered around something that they want to do, right? Fascial training isn't something that everyone's just obsessed with doing and loves doing, and that's all they want to do, right? You want to go lift weights, you want to go play basketball, you want to go run, you want to play football. And so if you can create it as a warm-up for that, now you can do it every single day. Every single training session, you can get 5 to 10 minutes of fascial training, and maybe you do it pre and post. Right? If 20 minutes is the minimum effective volume and you're doing 4 minutes a day for 5 training days, well, what if you did 4 minutes before and 4 minutes after? Now all of a sudden you're 40 minutes for the week, and you only had to add 8 minutes a day to your training session. But it's something that I think should be done year round, regardless of, it's not something that puts a ton of CNS fatigue on you, so it's not going to like disrupt your trainings, your training block.
Yeah, it's more like what you just mentioned, probably for to prime you, for like what you just mentioned, for warm up or like cool downs, right?
Exactly. It's not something that's overly fatiguing. And so I find that I mean, generally, anytime you use a muscle like pre-activity, in that activity, you are more aware of that muscle. So if you have a game or whatever, a training session, and you've just primed your glutes neurologically, but also fascially, now all of a sudden your training session is more effective with your glutes.
Yeah, cool. That's like, okay. So I'm going to jump into the next one.
Yeah.
And I want to talk about barefoot training. I know we just talked a little bit.
Yeah.
But instead of like fascia training, why should we train barefoot?
So there are a lot of intrinsic muscles in your feet that really become dormant when you have a shoe on. My wife actually calls shoes foot prisons. And so she's a big proponent of not wearing shoes. But you think of, if my foot, and this is going to be exaggerated, if my foot is meant to interact with the ground like this, but every time I put it in a shoe, it's like this, now all of a sudden, just necessarily you're losing, necessarily you're losing function in your foot just by wearing shoes. So having your foot in contact with the ground not only kind of stimulates different proprioceptors and gives you different input into your brain, but it also allows you to use the entirety of your foot. Now your foot is going to be stronger, right? And so anytime you interact with the ground on a football field, on a basketball court, whatever it is, your foot, everything is stronger from the ground up. So I've seen guys that I thought the mechanism was, if you keep moving, you tear an ACL, but foot fascia is strong enough that it becomes an ankle sprain instead of an ACL tear, because your body is able to put you in a position not to harm your knee, right? And so there's so much value in strengthening the intrinsic muscles of your foot. And when you go to do fascia training, having a strong foot helps kind of progress you way faster. So in the fascia training that we're doing online, I'm going to have several different levels, and the whole first level is just dedicated to being barefoot and learning how to use your foot again. And then you move into the next ones, and you get some jumps in, you get some heel elevated stuff. But like the whole first month, we'll call it, is dedicated to, can you train your foot? Can you strengthen your foot? And once people have that strength, then they're able to be so much more effective in their sport, in their training, and in their fascial training.
Cool. So, like, how about foot training with like multi-directional movement?
Yeah. I love, so I don't know if you follow Bobby Stroop at all, but he's Patrick Mahomes' trainer. He trains a bunch of professional athletes, but specifically Patrick Mahomes, and he starts not every day, but a good chunk of his training sessions with a multi-directional lunge, but it's barefoot. And so you're all of a sudden, okay, not only am I lunging forward, but now I'm lunging out to the side, and I have to change the direction that my foot is putting pressure into the ground. And so I think that's really important, because if you think of movement as only straightforward, you're missing a ton, right? And that's part of the problem with only weightlifting, is you're only going up and down, right? And so you're missing so many different planes of movement. So even when you're fascial training, even when you're barefoot training, you have to make sure you're hitting a ton of different movements, a ton of different planes and axes of rotation from your foot, in your knee, in your hip, all of that stuff, so that you're more well-rounded and less likely to injure yourself when it's very unpredictable in the sport.
Cool. That was pretty cool. So if go back to like fascia training and barefoot, and I know you post some things about like ankle stiffness.
Mm-hmm.
How do progress all these stuff?
So Well, first of all, I think ankle stiffness is, people always talk about ankle mobility, and I think that's important for some things. You can get into so many debates on should you be mobile, should you be tense, and I think once you kind of hit that requisite amount of mobility, just enough mobility to do what you need to do, not any more, not any less. Obviously, if there's less, you start to compensate. If there's more, then you're not as explosive. So once you kind of hit that requisite amount for what you need, the stiffness in your foot, the stiffness that you're able to create, decreases your ground contact time. And so now all of a sudden you have foot stiffness, and instead of it being a long, slow, step, it's quick off the ground. And so you're able to put so much more force in through the ground. And so that's kind of why the foot stiffness and ankle stiffness is important. Now, you train that, again, by a lot of time being barefoot. You start with the isometrics. You start with the foot strengthening. But then if you start to move towards plyometrics, so I like pogo jumps are an easy one. You start with just easy pogo jumps. Now you're working on keeping that foot stiffness through the pogo jump. Maybe you do a depth jump where you drop and then have to jump up again. And it's, can you maintain foot stiffness? And I think the way that I like to think about it is I'm not trying to overtake an athlete's entire jump training. I just want to improve it, right? I don't want them to be thinking about how their foot's contacting the ground when they're playing or when they're training with their strength and conditioning coach. I want them to only think about that while they're there with me. I want them to think about how their foot's interacting with the ground while they're doing their jumps with me, rather than when they're doing just a normal vertical jump or broad jump,
Why is that?
It takes away from the intention of what they're doing. So when you're focused on fascial training, I want you to be focused on the fascial training. When you're focused on jumping, I want everything else to be an unconscious thing. If let's take a basketball player. If I'm a basketball player, do I want to think about, okay, I need to have my elbow in and flick my wrist every time I shoot? Or do you only want to think about that as you're being intentional with your warm-ups and training? And then when you're on the court, you just want it to be natural, right? And so that's the same thing with fascia training. You want that to be ingrained in you so that when you go to do your sport, when you do your normal training, it's something that just happens because exactly. I see Haley in there said it's second nature, right? We're creating that response that's just happens when your foot interacts with the ground.
So basically, that's kind of why basically that's kind of why, like, isometric hold or like heel elevated like squats are so popular right now, right?
Yeah, exactly. And because it starts to create that stiffness. But what people definitely need to understand is that's something that you focus on in the moment, but you need to just play, right? You need to trust that your training is going to just take over, and you need to just play. There's a question that just came in. Should liver be eaten before or after training, or both? I think, just a quick aside on this, I think liver should be eaten I think it's a really good post-workout snack there. Tons of great nutrients. You can talk about nutrition for fascia and stuff, and I don't typically get into that realm, but liver definitely after a workout.
Cool. So we talk a lot about fascia training and like barefoot ankle stiffness. How about like shoulder mobility and like shoulder stability?
Okay, yeah. So that's something that really kind of needs to be diagnosed individually. Some people are very stiff, can't move their arm far enough. Some people are very flexible, but then can't stabilize their arm in the position. So that's something that that kind of needs to be identified on an individual basis. Typically, you can figure that out. The one aside that I'll say here is oftentimes people think that they lack shoulder mobility to go overhead when really they lack core stability to stabilize overhead. And so it's really something that you should have someone else evaluate for you, because you can't necessarily see how you're moving. Even if I look at myself in the side mirror, I can't see, oh, am I compensating with my back? And so my shoulder's actually in a good position. I'm just not, tense in my core. So that's an aside. You definitely should have someone else evaluate that for you so that you can kind of attack it properly. Now, the shoulder mobility, that one's something that just takes time, right? There's a bunch of different ways to train mobility. FRC, just regular stretching. It's however you kind of want to go about that. Once you get to that requisite amount of shoulder flexibility, I find that there are common shoulder patterns across a lot of sports, and that's a little bit of protraction, shoulder depression, and then having that anchored to your rib cage. And so training shoulder stability, I think, is more than just doing banded rotator cuffs. And I think you miss a lot if you just do banded rotator cuffs. And so I like to find the position that my athletes need to be stabilized in, find the athletes or the position that they need to be strongest in, and then what are the exercises, what are the muscles that stabilize them properly there. 9 times out of 10, it's the same pattern of like serratus anterior, lat, and rotator cuff, just kind of anchoring the shoulder blade and then allowing the shoulder to be stable in whatever throwing, shooting, pitching motion it is. But kind of understanding what the movement that you're trying to accomplish is, and then stabilizing best based on what that movement is.
Cool. So, no worries. So, how about the post you post on Instagram about like foot and shoulder connection?
Yeah. So that's something that I think oftentimes we forget about. There are oblique chains across your body that kind of connect lower body to upper body. And so if you think about running, if you only think about running as a lower body activity, you miss all of the rotation in the upper body, right? Same thing with pitching. If you think of throwing as only upper body, you're not going to be a good thrower because your foot needs to be in contact with the ground. You need to use your glutes. You need to use your legs to be an effective thrower. And so when we train lower body in isolation, that's good. When we train upper body in isolation, that's good. But we can't forget to work on the connection between the two. We can't forget to, make sure that we establish that link. Make sure that when you are working with a throwing athlete or a shooting athlete or a running athlete, you are connecting that entire chain in some form or fashion so that everything is being trained. And you can get into the pattern of this is solely lower body. We need to only work on lower body, and then miss a whole thing. It would be the same thing as segmenting your body, like lifting weights.
But yeah, I get it. But like from a poster movement, it was like different with like the chop and lift. The usual chop and why is that?
And which one was that?
I think it's the post with the MLB player.
Oh, was it the bear crawl rolling one, or the one kind of swinging the kettlebell?
Yeah, the one leg swinging the kettlebell.
Yeah, so that one specifically for him, he was coming off of a UCL injury, right? And so he had really, really tight muscles, and anytime he would try to move, it was a muscly throw. The dude throws the baseball in the mid-90s, like just throws gas. Really strong guy, squats over 500 pounds, like really, really strong guy. But what he didn't have was kind of, okay, how can I let my shoulder just be a whip, while I'm still using my lower body, right? Because if you throw and you're trying to muscle everything, that's where you start to have some energy leaks. But if your arm can be used like a whip, that's where you're able to generate speed. And so all of that power comes from your lower body. Shoulder blade is stabilized, and then your arm gets to act as a whip. So that's why that one, it's more, okay, can we have you using your core, using your foot up to your glute, and then your arm acting as a whip rather than muscling through and using all of your muscles to just throw the ball as hard as you can. It's, I want all the power to come from my lower body and then upper body to be a whip that just carries the ball. So that's why that specific exercise for him, that made the most sense. I like to do it with throwing athletes because, you know, it's good to have your shoulder just be able to relax. Your core and your lower body has to kind of respond to that.
Yeah. So it's like foot to core, lower body to core connection.
Yep.
And stabilize the shoulder, but relax the arm, right?
Exactly.
And all do it together. Cool.
Exactly.
That's smart. That's really smart.
Thank you. That was a fun one. I mean, it's a common exercise, but when you think about the intention behind it, that's where it makes more sense when and why you would use it.
Never thought of that.
A lot of it is observing the athlete that you're working with too, because kind of what I found is there are really two different types of athletes. I mean, there are a lot of them, but they're really tight, fast movers, and then there are really loose, slower movers. And so if you're a really tight, fast mover, you typically have a propensity to kind of over muscle things. And if you're a really slow or really a good mover that's slow, you don't have that fascial tension to allow yourself to move quickly. And so things change just a little bit. So the pitcher, he's a tighter, fast mover, and you can see that in how hard he throws the ball. So we need to give him better control of that tight movement. We need to move him more towards the center rather than keeping his shoulder really, really tight and trying to muscle it. If you get someone that's, you know, in the converse, and you probably need to give them more tension so that they are, you know, a more explosive athlete.
Cool. From what we just discussed, like basically like most of the thing you post on Instagram, like kind of like connect together.
Yep. I try to connect a lot of different things, and I found certain themes that I've been working through that show up with my patients or things that I'm working through myself here. But yeah, I try to have a kind of a connecting theme throughout all of it.
Yeah, kind of like the post with the NBA player in the mid season. You kind of do like rotation,
Mm-hmm.
and
Yep.
so from now I see it kind of like barefoot training, fascia training with a little bit eccentric.
Yep.
Right. And
exactly.
Also rotation. Cool. Pretty cool.
There's some good questions coming in. I don't know if you've seen these from Christian Villanucci, and he's asked a couple really good questions. Do you wanna talk about? Do you have any more particular? Because he's asked a couple really good ones.
Okay. If someone is stuck in an injury cycle, which are the main points you would suggest to become fascia driven?
You want to go after that one a little bit?
Yeah.
So I think if someone's stuck in an injury cycle, you need to look at the movement patterns that you have. Because obviously there's something that continually breaks. And is it because you're in a contact sport and you're getting hit? That would make sense. If you're playing football and you're constantly getting hit in one side and you have an injury, you keep getting injuries to that side, that makes sense, but you can still kind of fortify that through training. So the first thing that I do is look at your movement patterns. Just filming yourself moving is one of the most eye-opening things that you can do. Okay, I didn't realize that my foot looked like this when I jumped or when I kick or when I throw, and you can just kind of gain an understanding of yourself as an athlete. From there, I think there are very consistent patterns that prevent injury, and so we start to train them. So this guy's a goalkeeper, groin and quad injury. And so I think specifically for this type of person, okay, you keep having a groin injury, you keep having a quad injury. We need to look at the soft tissue. We need to make sure that the soft tissue is healed, that the fascia is healed. There's the fascia muscle interface where you need to make sure that is continually healing. So maybe we have to do targeted soft tissue on you. There's really good research on kind of the Graston and the instrument assisted soft tissue like gua sha, that sort of a thing, and that can be really beneficial. Getting your hands on there can be really helpful there. So I start with, can we make the tissue a little bit healthier with some of the soft tissue, and then just like we talked about, how can we start to work in eccentrics, right? I have a couple. I have at least one on there for the quads that kind of makes the tissue more resilient. Once you kind of have the tissue feels healthy, and that may be where any individual person is at after all the rehab and stuff. But once the tissue is healthy and the function is there at an individual tissue level, that's where I start to train the proper movement patterns. And you can start that early on, but a lot of that is maybe your foot's interacting with the ground improperly. Let's work on that movement pattern. Maybe your knee twists. Most people think of knee as flexion extension. There's rotation in the knee. Maybe you have too much, not enough. Maybe your knee isn't rotating properly, and so now we need to start training that. Maybe you're not using your glutes to move. Maybe it's a lot of quad-driven movement. Maybe your core is not stabilizing, so then all of a sudden it's hip flexors and quads and groin. And so there's a bunch of different ways that you can kind of, if you came into the office, we would evaluate a ton of different things. But I think to start, film yourself playing, see what maybe some consistent injury patterns are, work on the soft tissue, and then the least injured athletes that I've seen have consistently loaded the glutes and then been able to brace their core properly. And so I think those three things are the direction that I would head generally. And then obviously you get your hands on someone and things change and you can get way more specific, but that's kind of the direction that I go. Make sure the tissues are healthy, film yourself, understand what your movement patterns are, and then train yourself in the proper movement patterns.
Cool. Okay, there's another question from him. It was, is lifting weight like damage the fascia?
No. So lifting weights is not going to damage your fascia. It's for a lot of athletes, you do need to be in the gym, right? I think there are some sports and some positions where you can argue the gym is not nearly as important, but we'll just say generally, I think the gym is important and will not damage your fascia, especially if you're doing fascial training in the midst of all of it. If you prime your nervous system and you do all of your fascial training right before you lift, that's not going to be a damaging session. You're not going to be injured just because you're in the gym. I know there's this I don't know, it feels like a myth to me that being in the gym is bad for you right now. I think for certain athletes, lifting weights certain ways is suboptimal, but I don't think it injures you. Does that make sense?
Yeah.
Like, does a soccer player need to go and do power cleans? I don't think so. But does that mean that them going in and having stronger hamstrings and having stronger muscles will hurt them? No, I don't think that's the case at all.
Agree. Totally agree. Okay, that's about like all the questions I have for today.
Awesome.
Thanks, man. Thanks.
Yeah.
Appreciate it. So if there's like coaches interested in what we talk about today, where can they reach out to you? And is there a future program or like future online courses?
Yes. So right now I'm working on I'm working on the fascial training online That's going to be fully launched probably February, March. And so, follow me and turn on post notifications so that you make sure you don't miss that. But so that'll probably go fully live in the next couple months. I'm going to do a little bit of beta testing here. So there will be some groups that will be running early on. And it's going to be, a fully online system, not necessarily customized to your sport, but it's going to be general enough where, hey, you're going to have all the fascial training you need, and then you go play your sport, and then you go do your lifts, right? This is the primer. This is the injury prevention. This is that small performance boost that you get. And so, so that's coming out. I'll probably try in a week or two get a beta test group. I just finished all the programming for lower extremity 1. And so keep your eye out for that. Instagram's the best way to contact me. Email as well. You can email me at rehablabchicago@gmail.com. That's on my Instagram account as well. But yeah, Instagram DM, Instagram comments, and email. You can definitely get a hold of me and keep track of what we got going on.
Cool, man. Thanks. Really enjoy talking to you and talk about like fascia training. Love it.
Thank you. That was a lot of fun. Thanks for asking me to come on.
Good. I would love to like invite you for a second time. Okay.
Yeah, definitely.
Cool.
Definitely. Well, I'd love to do this again. We'll plan on something in 2022 as the launch for the training system goes live.
Cool.
We'll plan something out. Sound good?
Okay. Cool. Thanks.
You got it. All right. Have a great rest of your day.
Yeah. See you.
Bye.
Bye.